Welcome to KMET 1490 AM ABC News Radio and the Southern California Business Report with Yvette Walker, a show dedicated to highlighting successful Southern California businesses and the people behind them.
Welcome and thank you for joining Southern California Business Report on ABC News and Talks KMET 1490 AM, 98.1 FM, and KMET TV. I'm Yvette Walker, live blasting our signal from the center of Southern California, serving a population of over 25 million. Get us crystal clear and on demand by downloading the free live streaming app on Google Play and the Apple App Store. As always, a huge shout out to the team, Mitch, Bill, and Sean. I love you guys, and to our special advisory committee that can be found at www.scbrtalk.com/advisory committee. Thank you. Today, I have the distinct privilege to introduce Dr. Dora Barilla. She is the president of HC2 Strategies and the co-chair of Stakeholder Health. She is the former VP for Community Health Investment at Providence and the founder and chair for a nonprofit organization, Partners for Better Health, promoting health initiatives in communities. Dora has spent last 2 decades putting together plans in place that are strategic, effective, and yes, downright creative. Dora understands that a proactive health policy requires innovative thinking and action, and nothing less will do. As co-founder of HC2 Strategies, Dr. Barilla has been a key thought leader and proven innovator who has spearheaded strategic plans for known health systems and communities. Looking at needs, assessments, implementation, strategy, advisement, coalition building, systems, and policy changes, the many spokes in today's healthcare wheel, Dr. Barilla drives a meaningful change we need in our ever-changing healthcare environment. She lives in Southern California with her husband, Tom, and has 2 grown daughters. Thank you so much for being with us here today, Dr. Barilla.
Thank you for having me, Yvette. It's truly a privilege.
Beautiful. So as you know, I ask every one of my guests to please take us on the journey as to what inspired you to pursue a career in the healthcare field.
Thank you. And it's such a, it's never a linear journey. I've always known that I wanted to go into healthcare. But, in the 80s, it was you're a nurse or you're a doctor. You didn't have the many spokes that I think are more aware today. So what really inspired me was more of a holistic approach. I always knew I wanted to look at prevention and wellness as a key component of, looking at health. And, it wasn't until I really understood kind of what public health was that I found my home. Although I've worked in healthcare systems the majority of my career, it really is more a holistic way of looking at not only yourself in body, mind, and spirit, but looking at how you interact with your community.
That is remarkable. So tell us a little bit about the founding, the development of HC2 Strategies and what exactly that is.
Yeah, thank you for that. I like I said, I started working in a hospital in 1986. And so always really been on the journey of more of I thought health was healthcare. But it really, there's so many more components to it in terms of, how you live your life, your social connections, your education, where you live, your zip code. So there were so many factors that really impacted health. And so after working in healthcare for the majority of my career, probably close to 20 plus years, my business partner and I really saw this opportunity, and I think the next frontier of healthcare. That's why we started HC2 Strategies, Healthy Connected Communities. And it was really looking at how not only hospitals, work with counties, work with community-based organizations, but how communities interact and work together across all the different sectors. Because it can't be a hospital that is always trying to fix community problems. The emergency departments were seeing failed systems, and all they, really had were clinical tools. And so, that was really the inspiration for us to start HC2 Strategies, knowing that we needed a different kind of strategy and a different kind of consulting company.
I love that. I love your proactive and tactical approach to such a huge problem, right? It's a challenge for everybody, regardless of where you are on the spectrum. Healthcare is a critical need for everyone, and there are a lot of challenges, right? And this is pre-COVID. So coming out of COVID, I know there are plenty more. Please talk about, the public policy and education elements that HC2 strategy works on to implement and drive these social outcomes for better health in communities.
Yeah, so what we really do is look at, I'm a doctor of public health, so that has always been. I always say, if a medical doctor has a patient, assesses a patient, and prescribes, some type of treatment. Well, a doctor of public health really looks at the health of the community and the people in the community, and then really looks at strategies and innovations to help improve communities and what that looks like. And so what we've done is, really started with assessing the community, knowing not only, the data, but also listening to people in community. Communities know what is wrong in communities. Ask anyone today, we know that it's those that are experiencing homelessness are, increasing. We're seeing a lot of mental health, a lot of substance use. It's not a lot of rocket science. You don't need to, go deep into the data until you really want to look at who is it impacting and what are the right interventions. So what we've done is really started from understanding community, understanding those who live in a community, what the assets are, what can we build on, what are some anchors in an in a community, and then really pulling together multiple sectors to address them collectively. Because it can't, like I said, my home and my safety place has always been in a hospital, but hospitals can't solve homelessness. Hospitals can't solve a lot of the social issues that are happening, but they certainly can partner. And so what I've been, really working on over the last 8 years is looking at creating that platform where we can reach across. To solve homelessness, we're going to not only need hospitals and health systems, but we're going to need the criminal justice system. We're going to need the mental health system. We're going to need, local community-based organizations. We're going to need churches. We're going to need individuals working together. And so what we've done is really try to create that space and then identify some of the best practices and emerging practices, what has worked around the country, and then bring that to play so that people can do things differently. We know what we've done isn't working. And so how do we really look at strategies and coaching leaders? It's really about, leaders being courageous to look at the long game. Often we're looking at the short game, but when we're looking at systems changes, societal changes, we really need to look at the long game and not polarize the conversation and the strategies, but bring together for everyone. We all want to live in a healthy, productive community where we all can thrive.
Absolutely. And I love that you are focused on building those bridges among those community assets to say, how can we make an effective, positive change using the resources we have today? I absolutely love it. Please talk a little bit about more of the critical areas of public policy that you're focused on today.
Yeah, so when you're looking at public policy, there's all different, we always say the big P and the little p. So there's policies within organizations, there's policies within, communities and within counties, within states and the federal government, and then nationally. So, not to say that we have a lever on all of those, but really understanding what levers are going to make a difference. And what's exciting about right now is, I know you probably hear a lot in the news and discouraged about what's happening, but there's some really positive things that are happening in terms of people really understanding that post-COVID, that, if we're going to move into what we call recovery and resiliency, we're going to have to do things differently. And it can't be based on it as an administration or someone, a leader. And so really working with, in a sense, the tide of what's happening at the federal government in terms of really understanding that we're going to need to do things differently. I'm a fifth generation Californian, so California, and I think there's, I know we have our challenges, but I'm here to stick them out and really, make our state better. And I live in, as you mentioned, I live in the Inland Empire and have for 32 years. And so really see the opportunity with the state of California. There's what we call CalAIM, and then it's a new policy coming out of California to really address a lot of the problems and challenges that we've seen. And I think a real opportunity to pull together some of the policies, from around or from the past 2 decades, building upon what we've learned. And then, what our role is really helping to influence how those policies are being implemented in counties across the state of California. So that's been a big focus, and I think an incredible opportunity right now for us to say what's possible. There's been a lot of funding that has come in, with a lot of different initiatives and strategies. And so how do we take a lot of that funding and not only do transactional strategies and activities, but really look at what's the transformation, and what's what we say the new community health architecture that's really needed for us to sustain the changes that are needed.
Absolutely. In fact, today I just read a great report that San Antonio Regional Hospital just officially launched their clinical shadowing program, which means that they're creating a direct pipeline with high school students into the health, world to offer them a beautiful, thriving, successful field and a career, while creating an environment where those healthcare providers are there for the community. So there are no shortages of healthcare providers. And please talk a little bit about how CalAIM works towards similar types of innovative initiatives or policies in California today.
Yeah, so let me kind of take that in 2 pieces of it, because I think you touched on something that was really important, and then that's the future leaders that are going to actually implement the policies, because we've had generations of individuals that have worked in silos and actually been incentivized by working in silos. So what's really exciting, what San Antonio Regional Hospital is doing is, reaching out to that next generation and preparing them for what's needed in health, not only in healthcare, but what's needed in health. So it's we always are going to need physicians and nurses and physical therapists and, a lot of the other, core healthcare workforce, but we're also going to need a lot of people that are trained in mental and behavioral health. We're going to need people that understand public health. We're going to need people that are, understand and have their background in social work. So it is really just saying, the world is your oyster in terms of health and healthcare. And what we call, often we refer to them as multi-solvers. So it's how are we solving, some of the issues in communities, having a strategy, working across sectors, and really addressing, the issue. And if you're going to look at overall health, having a good job with health insurance,
right?
And
Yes.
there's nothing better than that. So this, really helping people to have a future in health and healthcare is so critical. So kudos to San Antonio and to some of the other hospitals that are really investing in the future and helping kids understand. It's a lot of times it's that math that gets them hung up, or they might not understand what all the opportunities are. So really exposing our kids and saying, we need you. The world needs you to, really help us solve these issues. And I love working with the next generation because they get it. You don't have to explain to them the connectivity and how, a lot of social media and how things are interconnected. They understand AI, they understand technology. And so it's just it's so refreshing. And I think inspiring to say, how can we partner not only with the hospitals, but also with the local universities? I know San Antonio Regional Hospital has a partnership with the University of Laverne, Western University, and other universities that are really trying to promote, the healthcare workforce. So that's one, I think one piece of it. And then there's this other piece, as we're, I not only work in the Inland Empire, but I work across the state and across the country. And what we're finding is that, this is that working in healthcare is tough. And we really need to, equip our leaders with what's to come and what they're experiencing. And so if you're God bless emergency room physicians and emergency department nurses, because they are really experiencing the brunt of society, and they need that encouragement and to really look at what are the other alternatives that are possible for then people coming to the emergency department. We need an emergency department. If you have a heart attack, you get in a car accident, we need that emergency department to be available for those emergencies. And oftentimes, that's not always what is happening in our emergency department. So I think really understanding what are the alternatives, what's the system of care for populations, to access primary care. Often it's the logical choice to go to the emergency department, but what we really need is a system of care. So I think that, there's two parts to that we really need to look at, and we really need to be thoughtful and innovative and work across systems to solve some of the challenges we have.
Absolutely. We need more healthcare heroes, right?
Yes.
Because that's what they are. And, no other time probably in history have we seen it more clearly than, during the pandemic just a couple years ago. So thank you to all the healthcare heroes out there. For those of you that are thinking of becoming one, please come on board, find a career in healthcare, and be a part of the solution to serve these thriving communities. So Dr. Barilla, what would you say is the common thread between communities for healthcare disparities?
Well, thank you because there's healthcare, and then there's the disparities that exist, because we know that health is not equally distributed. So really looking at, and you can't have a more diverse population than California. And so really looking at the disparities across California and understanding where health isn't equally distributed, and what are the factors that are contributing to health disparities. And so, really understanding that a lot of times it's zip code, a lot of times it's race and ethnicity, your economic status, but there can be a lot of other things that are, contributing. So understanding what are the factors that are contributing to health disparities, not making assumptions, and really looking at the data. Just recently, when I talk about recent, I'm the last decade that we've really started to look at data, healthcare data, through the lens of factors that contribute to inequities. So really looking and understanding, and then, like I said, bringing in who's in our community, and ensuring that the workforce is reflective, and that there's an understanding of some of the cultural differences and backgrounds, and what drives health, what's meaningful to people in their healthcare decisions. And then, so, I think in terms of what's the common thread is, obviously, what's really contributing to, health inequities, where we live, how we live together, our educational status, a lot of discriminatory policies that we've had. In our communities, in our country, whether they're conscious or not, are some real common threads. So I think understanding that, having a fair conversation, I know it can be often polarizing, but really understanding, and then coming at it from a sense of, collaboration and working together, and not of blaming, but really looking at what's really happening, and then how can we collectively address and solve for that.
Absolutely. And as you mentioned, healthcare can be a very polarizing topic, but it is a necessary opportunity and, given resource for everyone, right? So it's important to understand, the economic impact of offering healthcare to everybody and then not offering healthcare to everyone, right? Because there are economic impacts to both sides of the coin. Have you studied the economic impact that are negatively affecting those with healthcare disparities?
Well, I think the reality is it impacts us all. We're all impacted by that. I think some of the recent, estimations are that, it's costing the U.S. economy $1 trillion a year. So that's pretty significant. And that's really looking at, it isn't just those that are being impacted by health inequities, but it's, if you're not well and your burden of disease, you're not going to be, necessarily going to work. There's going to be a lot of issues that are impacting health inequities. And then for those that are impacted, It's often, a lot more, their healthcare costs are exponential because, they weren't treated at an early stage. So it might be that they're in a late stage disease. They necessarily didn't receive access, or when they did, perhaps they weren't treated equitably. We didn't understand, perhaps what were some of the social drivers that were impacting their health outcomes. So I think it's really, an economic burden for all of us to address that. If people aren't productive and thriving, we're not going to have a productive and thriving community or economy. So, we need people, especially starting with children. And, many of you have been following the data around, the decline in maternal and child health. That's just horrifying. In public health, we always say that that's the last chapter of the story in a community is, infant health. Mm-hmm. And when that's declining, and disproportionately, amongst some race and ethnicities, then that's a problem for all of us. And, and it's going to cost all of us if we don't really address it and find solutions that work.
Please talk a little bit about that maternal health and the infant health that you just touched on.
Yeah, so if you look at the data across the country and even in our local communities, that infant mortality has increased over the past decade, with significant increases, especially in Black infant health. And so disproportionately, when you look at the data, you have a disproportionate impact in some race and ethnicities, and what's contributing to that, and really understanding that, and that impacts us all. If you're not starting off healthy, that puts you at a deficit from the get-go, and so that's going to cost communities as a whole, but it also costs us as society in terms of having healthy, productive generations, for a lot of things. So, just a really, I think, something that we all need to be concerned about, what's happening in terms of the social environment that children are living in, what's the access for pregnant women, and what are some of the behavioral health or some of the other risk factors that are contributing to that, and understanding that and providing a cohesive, connected community for families is a great intervention. And research has shown time and time again, if you invest in those first 3 years of life for a family, that it has an exponential financial impact. But set finances aside, so you've got, the financial impact, but just the impact to society as a whole is so significant.
Absolutely, which is why, preventative health is such a critical area. Speak a little bit about preventative health and how that plays into the larger picture.
Yeah, and I really like to look at just kind of look at, we always want to think about the old adage that, an ounce of prevention is worth a pound of cure. And so looking at what does it mean? What does prevention mean? And so really changing that perhaps to what are the vital conditions that we all need to thrive, starting with those that are struggling and suffering. Because, we've built a lot of our systems and our systems of care, not around those that are struggling and suffering. And so if we think about what are the conditions in a community that, that are really going to prevent or produce wellness, or what we call well-being, it's really having humane housing, right? Having work and meaningful wealth. Making sure that children and our society is educated, ensuring that the natural environment is healthy, that we have clean air, clean water. We've seen what's happening with some fires, and I was just at the 4th of July. I was looking at the air quality, and I thought, why is the air quality so bad on July 5th? And it was because of the haze and the fireworks. So. How are we living in an environment that's really healthy? And then really looking at how do we have, transportation? How are we looking at basic needs and safety? So how do we make sure that people do have access? So going to that prevention, have access to care overall, not just healthcare, but have access early on. Because like I mentioned, the emergency department, it's often easy to, go into the emergency department at the last minute if you couldn't get an appointment with your primary care provider. Or, perhaps, you weren't able to access the services that you needed when you were sick. So having a more holistic sense of creating well-being in our communities through vital connections, versus, always looking at, what we call the urgent services and, responding to that. So not that we don't need those, but we really need to think about vital conditions and health and well-being and prevention.
Beautiful. Well, we're up on a break. Dr. Barilla, give us one moment. All right, everybody. Yvette Walker here with ABC News and Talk Southern California Business Report with Dr. Dora Barilla with an update on the challenges and opportunities within the healthcare landscape with a focus on strategies aimed at growing healthy communities when we return.
Ontario International Airport is on to a better way to fly with over 65 daily nonstop flights to more than 20 major destinations and the easiest airport experience in Southern California. Visit flyonto.com/Ontario to learn more about Ontario International Airport today.
Hi, I'm Dana Rademacher with MGR Property Management.
A lot of people wonder about the value that property management has for their property. Property management can include all property types, including residential, commercial, and HOA. It is valuable because property managers are experienced in what can happen at your property. We're aware of liabilities. We're able to do predictive and preventative maintenance. We know what is coming up with the changes in the weather, the seasons, how old certain aspects or different capital projects at your property are. We're able to best negotiate contract pricing, legalities with your tenants, and anything else that you may need to ensure that you're getting the full value of the property. If you're interested in speaking with the representative at MGR Property Management regarding your property management needs, you can visit our website at mgrrealestate.com, or you can call our number at area code 909-581-6600 to be connected with the representative.
Hi, Ray Lance from the Diamond Center in the Claremont Village here. One of the coolest parts of a third-generation family business is getting to know the families we serve through generations. Once you experience our friendly service, our fair and transparent pricing, and our beautiful jewelry that we make to last a lifetime, you'll stick with us too. Come visit us in the Claremont Village or at Lantz, L-A-N-T-Z, diamondcenter.com and see what makes us different.
Cal State San Bernardino is home to the only school of entrepreneurship in California. With globally ranked degree programs, you can start your journey today to become a successful entrepreneur. Learn more and connect at entre.csusb.edu.
Hi, I'm San Bernardino County Sheriff Shannon Dykes. If you're looking to start an exciting career in law enforcement and make a difference in your community, we are hiring dispatchers, nurses, deputies, laterals, and many more. For a complete list of our jobs and more information, visit sheriffsjobs.com.
The University of La Verne is rated first in California for alumni satisfaction. Learn more about accelerated programs offered online and on campus in La Verne, Irvine, Ontario, Burbank, or College of the Canyons. Visit go.laverne.edu. The University of La Verne. go.laverne.edu.
Welcome back, everyone. Yvette Walker with ABC News and Talk Southern California Business Report here today with Dr. Dora Barilla with an update on the challenges and opportunities within the healthcare landscape with a focus on strategies aimed at growing healthy communities. Thank you again for being with us today, Dr. Barilla.
Thank you, Yvette. So glad to be here today.
Wonderful. Well, prior to the break, you gave us an insight as to what HC2 Strategies is focused on, where those disparities lie, and the true economic impact that it has on the country for those that are not insured by healthcare do not have access to proper healthcare. Thank you so much for sharing that. So I'm going to, go on and ask you, what are the greatest changes you have seen in the healthcare field within the last 3 years?
Yeah, I know we've seen a lot of challenges, and I know there's a lot of financial challenges, but I think we've also seen the opportunity to really shift some of our models, and also to really look at that it's not just healthcare. Before the break, we talked about what are the vital conditions that are necessary for health and well-being. But one of those things is, what we often refer to as civic muscle and belonging, and really looking at, how every individual can take part and be a part of the solution. And so, we've really tried to look at working across sectors and really understanding what, I think what some of the opportunities are to not only work with healthcare, but work with social services and work with community-based organizations. So in the last 3 years, I think that happened as just a matter of happenstance, that COVID amplified the disparities we knew that existed. So you saw, communities disproportionately dying, due to a lot of the conditions that we were talking about earlier. We've also seen I think the opportunity to what can we do at home. We've also seen we had such a rapid adoption of virtual health or telehealth during I think during COVID. And then we also saw, the need and the opportunity to integrate mental health into our overall care. So, I think it's the bridging and the looking at innovative opportunities, and then really looking at how communities can take care of themselves. I'm not going to lie, there's going to be a lot of challenges in healthcare. People are always looking at, healthcare systems as, having the dollars, having the money, having the solutions. But, if you ask any healthcare economist, the numbers just don't pan out. And so, through CalAIM is really looking at not only how do we address, some of the clinical issues, but how do we address the social drivers that we know are escalating healthcare costs, and really addressing health inequities. So those three things, I think, and then really looking at an integrated approach has been transformational. We're not there yet, but I think people have a realization of what had happened, and we need to really build on that. And then also, really think about how we can adapt and change.
Beautiful. And Dr. Barilla, when you talk about social drivers, please share a little bit about what that looks like.
Yeah. So, if you look at, it really creates health. It's not always having access to healthcare, although that's an important part of it. If you're not eating properly, or you have proper nutrition, if you don't have social connections, right now I have 4 sisters, and we always say, who's on mama care? Because we take turns taking care of my mom, and she's blessed to have that social, those social connections. And not everybody has that, so they can't necessarily be discharged from a hospital. If you're experiencing homelessness and you're diabetic, do you have a place to clean your wounds? Do you have a place to store your insulin? So, there are so many social aspects to overall health, and so understanding how they work together. I know that can be a polarizing topic. That's not about. I like to think of it as more a whole person approach to really addressing what happened, what creates health. And I know I've had, experiences with loved ones that I have that are well insured, but having some of those social connections and those, what we call in CalAIM community supports have made the difference and actually have driven down cost to ensure better outcomes.
I love it. So you have seen positive results as a result of some of these solutions that have been implemented in the healthcare field.
Absolutely. We're seeing it, that people can actually have some of the resources that they need, environmental accessibility, like I said, my husband is a firefighter and was hit on the 10 freeway in 2005 and had a horrible accident. Mm-hmm. And, it was, I wanted to bring him home and take care of him, but my bathroom didn't have, the slips and the rails and all of that. So what are the home modifications that are necessary? And so I've seen it personally, and then I've also seen it by really providing what we call that system of care around populations of focus, really understanding what is the care that they need. And I know anyone working in the healthcare system can be frustrated by not having the resources upon, when someone needs to be discharged, whether or not it's family care or the medical equipment or, access to a follow-up appointment. And so really thinking about what are those, what is the transition and what is the continuity of care?
So please talk a little bit about how HC2 Strategies steps in to implement these frameworks and systems within communities to address these needs.
Yeah, thank you for that question, Yvette. So we do multiple things. Our tagline is really to innovate, connect, and transform. How do you connect communities? And then how do you look at innovations that need to happen and then, causing the transformation? But let me give you some real practical applications, because we do a lot nationwide, but we also do a lot throughout the state of California. But one of the things that, because we live in the Inland Empire, really supporting our local hospitals. So one of the things that we did was support the Hospital Association of Southern California to create Communities Lifting Communities, which was a not-for-profit arm of Hospital Association, to get, to really look at community health improvement from a holistic approach. So we created, in a sense, some systems for communities to do it themselves, because our whole premise and our strategy is that we're not going to go in and, I love consultants, I'm one of them, but a lot of consultants come in and say that they have the silver bullet and they can fix healthcare. I always say run when that happens, because it's really about empowering those, the next generation that San Antonio is training up, to really empower them to say, how can you learn and adapt and pivot? And so we provide executive coaching to communities. We provide platforms for facilitation around what can we do together that we can't do alone. And then really help promote and scale best practices that are working, and really cross-pollinate, and then to really begin to look at and evaluate whether or not those are working. So currently we're partnering, and again, this is just a part of, us living in the local community. John Chapman with the San Antonio Regional Hospital and many other hospitals are working with the Hospital Association to bring all the hospitals and a lot of other entities together to say, what can we do collectively for behavioral health? We're all suffering. We're all struggling. We all shouldn't have to figure out this independently. So, what are the pain points and what are the strategies that we need to really ensure that people aren't just brought to the emergency room, but they're brought and then have some resources for care. I always say stopping the bleed, those urgent services, but also looking at how they can, really get support for treatment. Often I just read an article that, they're passing out Narcan up in the high desert, and that's great. Well, it's not great, but, it's great. It's a strategy and it saves lives. But once that person is resuscitated, how are we then looking at the policies that are causing it in the first place? And then also referring that individual to resources so that they can overcome the addiction. So it's, really not looking at, a single solution, but it's looking at a collective solution with a lot of different players so that we can solve the problem and not just tinker.
Right, absolutely. And my understanding is actually San Antonio Regional Hospital, under the leadership of Mr. Chapman, as you noted, may have created a framework or a program that the Hospital Association is on board with, along with the hospitals, for behavioral health, how to address it, which is going to be very exciting to see how that all, is activated and what the results are going to be as a result of that. So with that said, Dr. Barilla, please talk a little bit about those critical stakeholders and those that will really make a difference in implementing these critical strategies.
Thank you. That's just so important that it's not someone else that's really going to fix this. When you talk about who are the critical stakeholders, it's all of us. So even just as individuals, having conversations with your neighbors and understanding what are some of the challenges and how are we addressing them, and supporting your local elected officials, as well as your local hospitals. So it's us as individuals, and then connecting across, different sectors. So who are the key stakeholders besides all of us? Obviously the hospitals are instrumental to a lot of this work. Our universities and higher education, in terms of, developing that next generation of leaders, as well as, our community-based organizations. How do we the community-based organizations, what we found, and what a lot of us have known, is that they're trusted messengers. So how do we strengthen our community-based organizations to really have the resources and the skills and the capacity to, be those tentacles into our communities? And then our counties and our county services, looking at how is public health, behavioral health, and a lot of the other services within our county working together to really address the issue. We've got to really stop working in silos, and we need to start working together, so that we can make a difference. So it's bridging across different sectors. So it's really going to take all of us working together.
Right. And so how can the rest of us, the community at large, support these efforts and really be a part of the solution?
Yeah. I think one, I would encourage all of us to bridge across our differences. Whether you're wherever you are on the political spectrum or, just your philosophical spectrum, we're all human beings. And we all need to, work together in a community. And so I think doing some self-reflection, and I would encourage you to go and talk to someone who has a different viewpoint than you do. It doesn't mean you have to change your mind, but have a conversation about, how do we solve homelessness? Because let's have that conversation. Don't judge, listen, be curious and not condescending. Support your local hospitals and some of the initiatives that they're working on, and really help support your universities, and contribute to your not-for-profit organizations so that we can, really have a strong not-for-profit infrastructure. So that, if God forbid we ever do have another pandemic or serious issue, that they're fully equipped and have the capacity that they need to help our local communities.
Absolutely. And so with that said, Dr. Barilla, please share a bit about career opportunities that exist in health and healthcare today.
Yeah, what is there, and one, I just want to emphasize, healthcare, I know it can be, there's a lot of people that are leaving the field, but what we're finding is that when we're looking at the innovative strategies and through CalAIM and other things, that people are really becoming energized. If we can actually do the right things rather than trying to solve the problems, doing the wrong things. So I don't want to be naive to say that there's not some burnout within healthcare, because there is, but I would encourage you to think about the whole spectrum of where are the opportunities. If you want a secure profession, become a nurse. The RNs shortage and the need in our country is just profound. But also, we need people to go into mental health. And, our mental health providers, there's such a drastic shortage. And it's not only, looking at the whole spectrum, looking at, from a psychiatrist down to, a community health worker that's helping to support their communities and their local, some of their fellow community members. And, there's a lot of financing for community health workers. So, there's a lot of universities that have what they say, earn to learn, that career ladders. So get in and, get your hands dirty and figure out what it is that you want. Public health, we have a lot of public health programs around the Inland Empire and around the country. We need licensed clinical social workers, masters in social work. I mean, we need people that are looking at data analytics. If you love data and you love being on a computer and you love, really looking at, a lot of opportunities for analysis and really thinking about innovation. There's just so many opportunities in healthcare. It's a great paying, it's a much higher paying job. I know that there's obviously some financial strains on healthcare systems and in the world, but healthcare is really, there's so many opportunities. And I'm just going to do one further plug in terms of, I like to call myself a social entrepreneur. So really looking at where's the innovation and entrepreneurism to help solve some of the challenges that we're facing. We need businesses, what we call, in a sense, the well-being economy. We need businesses that are going to help us do good, do well by doing good. And so how can you create a business model that's really helping and being generative to heal our communities? I could go on and on, Yvette, but be encouraged, get some mentors, volunteer at your local hospitals, and get engaged in the world of health and well-being. It's a great future.
I love it. So, Dr. Barilla, please talk a little bit about your future goals and what success looks like to you and HC2 Technologies.
Yeah. So, I always say when I have a fellowship program, we're looking at, a lot of different sectors, we're training the next generation of leaders to really look at multi-sector partnerships, not only your MBAs or your people that understand finances, but your people that understand, social complexity. When some of my mentees become CEOs of health systems, I say we have new mental models that people understand that there is more than just healthcare, but it's health, and people start speaking in language of a mental model of really vital conditions and well-being, and people understand that there are strategies and solutions that we can do. We're so focused in on an old model that's dead and dying that it's hard to look up from the mire and say, what are the future opportunities for health and well-being, and where can we start directing and diverting? That's hard financially, but to me, that's going to be success when CalAIM is being implemented in a local community, and community-based organizations are working with health systems and working with, Medicaid managed care plans and working with, counties. To me, that in a connected system of care, that's success.
I love it. So, are there opportunities for engagement to support your effort?
Absolutely. I think, one, if you're listening to this and you're, whether you're a business or a county provider, or whether you're in your health system, start asking questions and get engaged. My effort is really all of your efforts. So I think it's going and asking your local leadership about what you can do differently to create the vital conditions. How can we create healthcare pipelines? Whether it's, if you're in a high school teacher in school, how can you, connect with your local hospital? Or if you're a business, how can you support some of the, the homeless efforts around your community in the county? And so I think there's many opportunities for people to really take a lever of thinking about this differently. But I think one of the greatest ways of is reaching out and having conversation about what's possible and opening your mind not only to your opinion and your lived experiences, but looking at it from a different perspective, perhaps, walking in someone else's shoes and understanding the decisions that they make, and really helping to understand and create an environment that, would support, someone to thrive versus, really being, in an environment where it's just negative and, it's constant, they're just constantly being fed opposition versus inspiration.
I love that. Inspiration versus opposition. Thank you so much for being with us here today, for sharing your insight, for your incredible work, and for your heart of service to bring these stakeholders together and build these beautiful, thriving, healthy communities, Dr. Barilla.
Thank you for having me, Yvette, and thank you for all the listeners. And I hope it's been inspirational and that you are inspired this evening and look at opportunities where we can all make a difference.
Beautiful. So for everybody listening to us today, don't forget to look for us on Facebook, YouTube, LinkedIn, and Instagram. Check us out on scbrtalk.com, and don't miss my interview with Erin Gruelle, a teacher, an author, and an activist who has been fighting for social justice for over 2 decades. She first gained national attention in 1998 when she and her 150 students appeared on an ABC special, Primetime Live with Connie Chung. Erin's students, affectionately called the Freedom Riders, came from backgrounds of poverty, gangs, and violence, and many were at risk of dropping out of school due to the school-to-prison pipeline. But under Erin's guidance, all 150 Freedom Riders graduated from high school and pursued higher education. In 1999, Erin and the Freedom Riders published their book, The Freedom Riders Diary, which detailed their unique journey from hardship to hope. The book became a #1 New York Times bestseller and was adapted into a major motion picture, Freedom Riders, starring 2-time Academy Award winner Hilary Swank as Erin. Next week, we will have DeAndre Lampkin, a law enforcement professional in California. During his tenure, he has earned several commendations for his work in educating youth, quality of service, community involvement, and response to mental health crisis. He is also the founder and chief executive officer of Care Staffing Professionals, a healthcare staffing solutions company that creates new jobs for healthcare professionals throughout the state of California. Mr. Lampkin is a seasoned public servant with a strong community service background and experience in starting and leading program initiatives. He successfully founded the DeAndre D. Lampkin Foundation, a 501c3 tax-exempt human services organization designed to promote social good projects throughout the United States. He serves as a planning commissioner for the City of Ontario, vice chairman of the Los Angeles Region Community Recovery Organization, board member for the Esperanza Scholarship Foundation, and board member for the Creekside West Village Master Association located in Ontario, California. You do not want to miss it, everybody. We will see you next week.
This has been the Southern California Business Report with Yvette Walker on KMET 1490 AM, FM 98.1, and ABC News Radio affiliate, a show dedicated to highlighting successful Southern California businesses and the people behind them. Remember to visit the podcast page on the KMET website.